Good morning, class. My name is Mrs. Lazat, and I am a nursing student at Liberty University working on my master's degree in nursing education. Today, what I'm going to present to you is information, importance, and instruction regarding the cleaning of surgical instruments. Most areas within a hospital or clinical setting will have a governing body that advises and recommends best practice. For the operating room and the sterile processing department, the two manuals that we use to guide us are the AMY standards and the AORN guidelines for perioperative practice. In addition to these, the makers of surgical instruments also provide to us what's called an information for use, an IFU, that recommends the proper method for cleaning, sterilization, and packaging of their surgical instruments. The importance of this presentation is to ensure that all healthcare facilities that utilize and clean surgical instrumentation are on the same page when it comes to reprocessing instruments. There are very specific guidelines that have been put in place that need to be adhered to during this process. Class, please remember that this is a huge patient safety issue. Now, if you think about it, these instruments could be used on you, they could be used on me, they could be used on your family, your friends, and we know they're used on the community. So I know I don't want these instruments that have been improperly processed used on me, and I'm sure you don't want them used on you. So let's extend this type of attitude and thought process to anybody that has the potential to be exposed to surgical instruments. We need to do our due diligence by protecting the safety of our patients by doing the right thing. Now, unfortunately, due to the multiple incidences of patients becoming ill and have even died from being exposed to transmittable diseases such as hepatitis C, HIV, and diseases that I can't even pronounce from being exposed to improperly processed surgical instruments, in September of 2015, the Center for Disease and Control and the Food and Drug Administration issued a medical advisory to all healthcare facilities that reprocess surgical instruments to review what they have in place right now, their current reprocessing practices, ensuring that they are complying with the manufacturer's recommendations. In addition to that, they also have to have policies and procedures in place that are consistent with current standards set forth by AMY and AORN guideline recommendations. And even they've taken this one step farther, and for most hospitals, especially those that are accredited by the Joint Commission, they're requiring that all personnel that have any contact with the reprocessing of surgical instruments, and this is from the bedside point of use, cleaning to and through the sterilization phase, that these personnel are annually tested for compliance, for knowledge, for update information, and for the actual skill of reprocessing instruments properly. Due to the confusion of not knowing the proper ratio of enzymatic solution mixed with water, water temperature, how long do we soak the instruments in the solution, what's the proper method of cleaning the instruments, a new, easier, and safer method of cleaning instruments at the bedside or point of use was approved for all facilities outside the sterile processing department and the operating room. This is a previous standard for clinics cleaning surgical instruments prior to transporting to the sterile processing department. As you can see, there are many steps that can be misunderstood, leading to improper initial cleaning of surgical instruments. As we well know, the first and most critical step in the sterilization process of surgical instruments is that first initial cleaning. This is a picture of the way we used to do point of use cleaning. The problem with this process is that the cleaning wasn't done properly and blood or bodily fluids are still in contact with the instrument and it dries. This can cause bioburden to form, which is almost impossible to remove. This is the new enzymatic cleaner for healthcare facilities to use after point of use cleaning at the bedside is completed. Further in the slideshow will be step-by-step instructions on how to use this properly. As I stated earlier, the first step in the sterilization process is cleaning. This is done at the bedside at the point of use. For example, once the healthcare provider hands you a dirty instrument, you should wipe it off immediately with a water moistened cloth. And the reason why we do that is because we don't want blood or any other organic material from drying on the instruments. Blood, saline, any body fluids at all are very corrosive and can damage our instruments. Once the procedure has been completed and you've wiped the instruments down with your moistened watered cloth, you want to transport these instruments to your decontamination room. And the way you do that is you have to put it in a leak-proof sealed container with a biohazard tag on it. On this slide, it shows you the different areas on the instrument that can harbor blood, body fluids, and or any other organic type of material. They're very difficult to get to, so that's one of the reasons why we don't want our instruments to dry until we get them to the sterile processing department. So the crevices of the instruments, the pores, edges, any serrations on the instrument, the shape of the instrument, and then lumens are very difficult also to get the blood and body fluids out. And if it dries in there, then it's impossible to remove. I love this slide. I was a huge Pac-Man fan when I was growing up. I think it's probably the only game I felt I might win at. Anyway, I digress. So this shows the enzymatic solution, which is our Prepzyme, chewing up the molecular glue that attempts to hold the biofilm to the surface. So when we spray the Prepzyme on our instruments, it keeps them moist and prevents them from drying out. We are now at the meat of the presentation. The following are the steps that need to be performed prior to transporting the instruments back to the sterile processing department. Now, the first step in the cleaning process is significantly important and cannot be overemphasized enough. This step is done at the bedside at the point of use. When performing correctly, this step in the cleaning process will reduce the amount of blood, bodily fluids, or organic material still left on the instruments. Now, this is a very important phase in preparing the instruments for the next step of the sterilization process, which is the decontamination phase. Now, at the point of use, the instruments should be wiped clean using a sterile, water-moistened sponge or gauze. And if you have instruments that have lumens, they should be flushed with a sterile, water-filled syringe to remove any blood or debris inside that lumen, and also it prevents the blood and debris from drying inside the lumen. Now again, please remember that saline cannot be used because saline has chloride ions and those cause pitting and deterioration of the surface of our instruments. Now the second step in this process is to go to your decon area and retrieve your container with a biohazard placard and bring it into the room where your dirty instruments are. Once you've got it into the room, then you want to place your instruments that you've already wiped down into this container, close it up, put your biohazard label on the container, and then walk it over to your decontamination area. Step 3 is to apply the PPE, which is your personal protective equipment. So in order to use the Prepzyme enzymatic cleaner, you must apply a gown, you must have gloves on, you must put a mask, and you must wear eye protection before you start spraying the Prepzyme. So this is a picture of Prepzyme that we use here in my facility. Once you've located it, then you're ready to move on to the next step. Once you've opened up your container, you want to make sure that all of your instruments are open, like scissors, hemostats, anything that closes. You want to make sure that it's open so that when you spray the Prepzyme on the instruments, it gets into all the crevices and little hidey holes of the instrument. You want to spray enough of the Prepzyme to cover all the sides of the instruments, but not enough to soak it. Also, make sure that if you have instruments that are sharp or that are very delicate, that you separate them from the rest of the instruments so that they're protected. The next step in the process is to actually transport your container back to the sterile processing department. And you do this by first ensuring that you have sprayed enough of the Prepzyme on your instruments. You want to put the lid on the container and make sure the container is sealed properly. Then you must put the biohazard tag on the container so that it is visible as you're walking to the sterile processing department. Now, sometimes we're not able to transport this container back to the sterile processing department right away. So you do have 72 hours to transport it. And the reason for that is the enzymatic cleaner, the Prepzyme, is only good for 72 hours. So if you've exceeded that time, then you need to respray it. So you'll just take the lid back off, make sure you have your proper PPE on, spray the instruments thoroughly again with the Prepzyme, put the lid back on, make sure that the biohazard label is on the container, and then transport it back to the sterile processing department. Now this is not ideal to do that, so it's best if you try to manage your time to ensure that you're able to transport that container within those 72 hours. This concludes my presentation on the pre-cleaning of surgical instruments prior to them being transported back to the sterile processing department. I hope that within this presentation you got an understanding of the importance of your job and the impact that your job has on the safety and the welfare of our patients. Now, in the nursing realm, we have lots of little sayings that we like to say. We like to post them on the wall, put them on the bottom of our emails. But the one that's very specific to the operating room and to the sterile processing department is do the right thing. And not only do the right thing, but do that right thing, especially when no one's watching. This is what strengthens our integrity and safeguards the well-being of our patients. Now, we have the unique opportunity to be the first line of defense when it comes to having a great impact on decreasing the possibility of patients being exposed to instruments that aren't properly processed. So if you find yourself in a situation where you are cleaning the instruments, or you may be teaching someone on how to properly clean the instruments, I hope that you're able to recall the information that I provided to you in this presentation to be able to effect that process. I do hope that you learned something out of this presentation and that you take that back with you to your respective units. Thank you.